present to you. It's a little different. If you're strictly doing cosmetology or barbering, I would encourage you to stick around because there's some key points in here that I think you're going to see come about in our other exams as we go along. So let's go ahead and get started. Our candidates are in place. They're told, you will prepare your work area for your client. You will set up the universal supplies you will use throughout the examination. You will also set up the supplies for the basic facial section of the examination. You will be expected to follow all client protection, safety, and infection control procedures. You will have 10 minutes to complete this section. You will be informed when you have 5 minutes remaining. Do not demonstrate any procedures until the verbal instructions are given and you are instructed to begin. Step back to indicate you have finished. Our instructions are always repeated and the candidates are told, you may begin. Your examiner is looking to see that they do disinfect all work areas completely with product labeled in English as an EPA registered disinfectant that is virucidal, bactericidal, and fungicidal. Now, folks, this is a little bit different. In the past, you've seen our instructions to say that it must be an EPA registered disinfectant that is hospital grade. Well, the government has changed and are no longer using that term, and neither are we. We are going to say in our future exams that it is an EPA registered disinfectant that is virucidal, bactericidal, and fungicidal. Now, in this exam, we are expecting that candidate to, of course, use wipes, as Wayne talked about earlier. All of our exams now require wipes, and that candidate must wear gloves in this exam to disinfect that work area. Once they have completed that process, they're to throw those gloves away. And then in 1.2, they're going to sanitize their hands with product that's labeled in English. Your examiner is also looking to see that the universal supplies are labeled in English. And certainly we're always looking to see that items to be disinfected, any soiled linens and trash, are disposed of in the correct manner throughout all of our sections. When everybody has stepped back to indicate that they've finished, our proctor will say, all candidates have indicated they have completed this section of the examination. We will now proceed. And then our candidates are told, you will prepare your client for services. Okay, so folks, basically that means you need to drape your client. That means the head and the body. We don't have a preference in the way that you do that. It could be with a turban, could be with a headband, a plastic cap. Some folks still like to use towels. Anything that you teach your student to drape and pull the hair away from the face would be satisfactory to meet that requirement. Also, we are expecting them to cover the décolleté area. That could be with a towel, it could be with a sheet, it could be with a cape or a drape. Just make sure that they are draping their client for the services. Then they're told, you will perform a basic facial. Now, this has changed a lot because in the past, we went through the cleansing process. We went through the exfoliation process. We went through the towel steaming. And so the subject matter experts that developed this exam said, we expect an esthetician coming for an aesthetics license to know how to do a basic facial. So they do give the information that the basic facial will include cleansing, manual exfoliation, towel steaming, massage, and mask. You will be expected to follow all client protection, safety, and infection control procedures. You will have 25 minutes to complete this section. You will be informed when you have 12 minutes remaining. Step back to indicate you have finished. The instructions are repeated, and candidates then told, you may begin. So your examiner is looking to see that the basic facial supplies are labeled in English and that any implements in 2.2 and supplies are visibly clean, meaning without dirt or debris. In 2.3, they're told that, or they'll be looking to see that they cleanse the entire face. Now, certainly here again, anytime they're working in this exam, near the eyes or the mouth areas, they need to hold that area or to brace that area. Now, we didn't say cleanse the eye and then cleanse the lip and then cleanse the face. It merely says cleanse the entire face. And we do expect them to cleanse the eyes. We expect them to cleanse the lips while holding those two areas and then distribute that cleanser over the entire face and then remove that cleanser. In 2.4, we want them to perform exfoliation with a manual exfoliant using an implement or material on the entire face, excluding the eyes and the lips. Now, here again, we realize that there are exfoliants for the lips and there are exfoliants for the eyelids, but this is an entry level exam. And so our instructions were that we were to exclude those areas. They'll basically apply that exfoliation product, and then they're going to use something to manually exfoliate, something other than their fingers. That could be a brush, it could be a 4x4 gauze, it could be a loofah, it could be whatever that you've taught them to utilize for the exfoliation process. It could certainly be a handheld brush, warning you that if it were a handheld brush that had a wooden handle or had natural bristles, that brush would need to go in the trash when they're finished because it cannot be disinfected. A plastic handle or metal handle brush certainly could go in the items to be disinfected afterwards. Then we want them to steam the face with a towel and remove the residual product completely. So let's talk about that for just a minute. So, as Wayne mentioned earlier, all of our textbooks are pretty much the same, whether it's barber, cosmetology, aesthetics, as far as utilizing a steam towel. The process is to remove the excess water out of that steam towel. Now, sometimes I see those towels that come in a six-pack cooler. Sometimes I see them come in a Ziploc bag. Sometimes I see them in a half-gallon or 2-gallon thermos. Any of those are fine. That towel certainly does have to be wet. It does not have to be hot. We are expecting that candidate to remove the excess water out of that towel, and we are expecting them to test the temperature on their wrist, not a glove, but on their wrist or their forearm. And Wayne mentioned earlier that Milady requires that we do that on the wrist, and Pivot Point says to test it on the forearm. So either of those areas are fine. They will then apply that steam towel over the face, making sure that they don't cover both the mouth and the nose at the same time. Now, there are going to be instructors out there that will tell their students, you've got the steam towel on there. I want you to go ahead and remove the product with that steam towel as you're taking it off. Afterwards, I want you to drop that steam towel into that soiled linen bag or container. There are going to be other instructors that say, I want you to lift that towel off the face and I want you to place it into your soiled linen bag. And I want you to take those cotton rounds or those cotton mitts that you've used for removing the exfoliant and remove the exfoliant after using those cotton rounds or those cotton mitts. Either of those are fine. You do have to towel steam the face, and you do have to remove the residual product. But you may use the steam towel to remove that product, but you don't have to. Afterwards, in 2.6, we want that candidate to demonstrate the massage procedure utilizing 4 different types of massage movements. Pardon me, in the past we said to demonstrate effleurage, petrissage, tapotement, or friction. Now we're saying to demonstrate 4 different types of massage movements. That could be the effleurage, petrissage, tapotement, friction, or it even could be the vibration or vibratory massage movement. After that, they're going to want to remove that massage product from the face and apply a mask and conclude the service. Now, here again, I would encourage you to send a mask that can be easily seen. Clay masks or mud masks work very well. Sometimes those gel masks are hard to see, and a lot of times that causes the examiner to come over and look closely, and that sometimes upsets your candidate or causes some anxiety with them. So a clay mask or a mud mask would certainly eliminate that happening. They don't need to leave that mask on for any particular time, just merely put the mask on and then remove the mask. Afterwards, we certainly would expect that candidate to apply a moisturizer or sunscreen or both afterwards, because that's what our textbook tells us to do, and that does help to conclude the service. We will be looking, of course, in 2.8 that they do maintain the drape throughout the section, and always we're looking to see that items to be disinfected, soiled linens, and trash are disposed of in a correct manner throughout that section. When all candidates have stepped back, our proctor would say all candidates have indicated they have completed this section of the examination. We will now proceed. And then our candidates are told, you will break down your work area and dispose of the supplies used in the previous sections of this examination. You will prepare your work area for a new client. You will set up the universal or general supplies you will use for the remainder of the examination. You will also set up for the following sections of the examination: hair removal of the eyebrow using simulated soft wax, tweezing, and facial makeup. You will be expected to follow all client protection, safety, and infection control procedures. You will have 10 minutes to complete this section. You will be informed when you have 5 minutes remaining. Do not demonstrate any procedures until the verbal instructions are given and you are instructed to begin. Step back to indicate you have finished. The instructions are repeated. Candidates then told, you may begin. So your examiner is looking in 3.1 that candidate does disinfect all work area completely with product that's labeled in English as an EPA registered disinfectant that is virucidal, bactericidal, and fungicidal. Here again, they are expecting that candidate to wear gloves during this process. At the end of disinfecting the work area completely, then they are to discard those gloves into the trash and then sanitize their hands with product that's labeled in English. They're looking to see that those universal or general supplies are labeled in English and that items to be disinfected, soiled linens, and trash are disposed of in the correct manner throughout that section. When everybody has stepped back to indicate that they have completed that section, our proctor would say all candidates have indicated they have completed this section of the examination. We will now proceed. And then our candidates are told, you will have 5 minutes to prepare your client for the following sections of the examination. Okay, so here again, now this is telling us that we need to prepare our client or to drape our client for the second section. It wasn't included in the verbal instructions in section 3. They have set aside an entire section of 5 minutes for you to prepare, or that candidate to prepare their client. You will have 5 minutes to prepare your client for the following sections of the examination: hair removal of the eyebrow using simulated soft wax, tweezing, and facial makeup. Please do not begin any procedures until the verbal instructions are given and you are instructed to begin. Step back to indicate you have finished. The instructions are repeated. The candidates are told, you may begin. When all candidates have stepped back, our proctor would say all candidates have indicated they have completed this section of the examination. We will now proceed. And then our candidates are told, and this is different, so listen very carefully, you will perform hair removal of the eyebrow using simulated soft wax and tweezing. You will select one eyebrow to demonstrate a simulated soft wax and tweezing procedure. You will be expected to follow all client protection, safety, and infection control procedures. You will be instructed individually by the examiner to demonstrate the soft wax and tweezing procedures. This is an untimed section. Do not begin to demonstrate the soft wax and tweezing procedures. You will be instructed individually by the examiner to do so. They will be looking, or the examiner will be looking to see that hair removal of the eyebrow supplies are labeled in English and that any implements and supplies are visibly clean. They will then walk up to your candidate and say, please demonstrate hair removal using simulated soft wax along the entire length of one eyebrow. Your examiner is looking to see that they do demonstrate the soft wax procedure along the entire length of the eyebrow. So here again, let me walk you through that if you don't mind. And let me also just remind you, now this exam only goes into effect January 1 of 2021, January 1. You will continue using the exam presently until that time on January 1, we will begin using this new exam. So to talk about the soft wax procedure, you really want to remember that you want to wipe that eye with an astringent toner, tonique, or prep solution. You're going to wipe that eye, and then you're going to dry that eye. You're going to take a small amount of simulated soft wax, and honestly, what we see many times is honey, sometimes molasses, sometimes even petroleum jelly out of a container that's marked as wax. They're going to take a small amount of simulated soft wax on an applicator, and they're going to apply that to the wrist. Here again, not to the glove, but to the wrist. That candidate is going to have on gloves. They're then going to dispose of that applicator into the appropriate container. If it were a plastic or metal spatula or applicator, it could go into items to be disinfected. Were it a wooden applicator, certainly it would go in the trash. They're then going to take a small portion of that simulated soft wax. They're going to begin at the beginning of the brow, meaning at the nearest the nose, and they're going to go the entire length of that eyebrow. They're going to dispose of that applicator. They're then going to apply a piece of Pellon, a piece of plastic, a piece of muslin, whatever you're teaching them to do along the entire area of that eyebrow that's been applied with wax. They're going to work that into that simulated soft wax. They're going to hold the skin taut, and they're going to pull that strip in the opposite direction. They're then going to throw that a piece of Pellon, muslin, or plastic into the trash. At that point, the examiner is going to say, please tweeze 3 hairs from the same eyebrow and conclude the service. So we are expecting that candidate. They can still keep on those gloves that they were using. This is so salon-like. A candidate comes in and we wax an eyebrow, and there's usually several stray hairs, so then we tweeze them. So that's what the subject matter experts had in mind when they developed this new exam. So we're watching to see, of course, that they brace because they are working around the eyes, and that they tweeze 3 hairs from the same eyebrow. We're looking to see, of course, that they then conclude the service. That means to clean that area up and try to apply a post-epilation product afterwards. We're looking to see that in 4.5, they maintain that drape throughout the section, and certainly in 4.6, items to be disinfected, soiled linens, and trash are disposed of during that entire section. At that point, the examiner is going to tell your candidate, please step back and do nothing until the next verbal instructions are given. They will then step back, record their score. They'll then go to candidate number 2 and ask them to apply the simulated soft wax. They'll ask them then to tweeze 3 hairs from the brow and then tell them, please step back and do nothing until the next verbal instructions are given, until all the candidates have been examined in that area. At that point, our proctor is going to say, all examiners have indicated they are ready to proceed. And then our candidates are told, you will perform facial makeup. You will be expected to apply facial makeup in the following order: foundation, powder, blush, eyeshadow, eyeliner, mascara, and lip color. You are expected to brace when working around the eye and the mouth areas. You will be expected to follow all client protection, safety, and infection control procedures. You will have 20 minutes to complete this section. You will be informed when you have 10 minutes remaining. Step back to indicate you have finished. Instructions, of course, are repeated. The candidates are then told, you may begin. Excuse me, I went a little ahead there. Let me catch up. So this is probably a good time to talk about that. You know, earlier when we had our second setup, I would have gone ahead and pull out my makeup supplies. Now that's not my products. Those are my makeup supplies, my applicators, my brushes, all my cotton rounds, maybe my sponges and that sort of thing. But I wouldn't actually add the makeup until I got to this section. And the reason for that is many times we're going to ask that candidate or expect that candidate to remove those products using infection control and apply them to a palette. Now that palette could be one that you would purchase at maybe Hobby Lobby or Michael's. You know, they're very inexpensive. The plastic ones that can be disinfected and used over and over, I think they're about $1.18 and 19 cents. I'm not sure. It could be a paper plate. It could be a foam plate. It could be a plastic plate. It could be grandmama's porcelain plate, but we're expecting that candidate to remove those products, from their container, remembering that those are backbore size because we don't have single use products, not supplies, single use products in our exam. So if I were that candidate, I would wait. I would put my foundation onto that palette and I would apply that. A lot of times candidates want to go ahead and pull everything out. They want to put it on their palette. They get nervous, or somebody goes to the bathroom, closes the door, it startles them. They drop their palette and they certainly have nothing to work with for the rest of the exam. So I would wait and put those products at the when I was actually beginning to apply the makeup, and I personally would apply them individually. I would apply the foundation and then work that foundation onto my mannequin. I would then pour my powder or take out my powder, apply it to, and go on and on and on. So let's move on. Your examiner is looking to see that the facial makeup supplies are labeled in English and that certainly implements and supplies are visibly clean. Now, I would encourage you that you use or send disposable applicators. These brushes are sometimes very nice, but if they're wooden handled or if they're natural bristle, we are expecting those brushes to go into the trash. We do like the disposable items. They're inexpensive, they're easier to use, and certainly once you're finished with them, they should be disposed of in the trash. In 5.3, we're looking to see that foundation is applied to cover the face, pardon me, that they apply powder, and that they apply blush. In 5.6, they're going to apply eyeshadow. Here again, making sure that they're bracing anytime they're working around the eye area or the mouth area. In 5.8, they're applying mascara, and we know your mannequin has no lashes, but they should be going through the process of just imitating that they are applying mascara to that mannequin. I would remind you that that mascara applicator has to be disposable because of the possibility of contracting or spreading pink eye or conjunctivitis, as well as the lip color applicator has to be disposable because we don't want anybody possibly spreading herpes simplex from client to client. So make sure that those two are disposable. As far as the eyeliner, we don't require them to sharpen a pencil. They may use a pencil. If it breaks, then they would want to sharpen it. But otherwise, everything in that kit is clean and ready for use. And then as we want them, if they want to use a liquid liner, we don't have a problem with that. And they can certainly use that. They would have to, of course, use a disposable applicator for that. As far as the lip color, they can take a spatula, scrape a little bit of that lipstick onto that palette or onto that stick, and that becomes their palette. If that's the way that you're teaching them, certainly that is very permissible. They don't have to chunk off lipstick into onto their palette. In 5.10, we are looking to see that they maintain the drape throughout that section. And then certainly we're looking to see that items to be disinfected, soiled linens, and trash are disposed of throughout that section. When all candidates have stepped back to indicate that they've finished, our proctor would say, all candidates have indicated they've completed this section of the examination. We will now proceed. And then we have our blood exposure. It's a little different. I know that right now you're used to having that cut on the forehead, and I know that sometimes you're not sure when to remove that bandage because you're about to go into microdermabrasion. And we do listen to both our examiners and our school owners, and so we happen to be at the workshop where they were implementing this and saying this is a problem, and people are confused when to remove the bandage so that they can do the microdermabrasion. And so your subject matter experts at that time just move the cut from the forehead to the chin so that you don't have to deal with that any longer. And I'll address when I get to my subject or asking questions, I'll address when to remove it in the present exam. So our candidates are told, you will demonstrate the blood exposure procedure. You will imagine the following scenario. During the service, your client has sustained a minor cut to the chin. The injury is such that you can continue with the service. You've not come in contact with the blood, and your work area has not been contaminated. You are expected to demonstrate the proper procedure for blood exposure. You will be expected to follow all client protection, safety, and infection control procedures. You will have 10 minutes to complete this section. You will be informed when you have 5 minutes remaining. Step back to indicate you're finished. Instructions are repeated, and then our candidates are told, you may begin. So, in 6.1, your examiner is looking to see that the blood exposure supplies and materials are labeled in English. In 6.2, they remove the materials from the first aid kit, either by sanitizing their hands or putting on gloves. In 6.3, those supplies and materials certainly should be visibly clean. And in 6.4, we want that candidate to wear gloves prior to touching that mannequin. In 6.5, they're going to cleanse that area with an antiseptic. That could be an antiseptic wipe. It could be with alcohol prep pad. It could be even with their hand sanitizer, because it contains it's predominantly alcohol anyway. Afterwards, we want them to cover that wound with a dressing that is absorbent and secure. And in 6.7, we want them to dispose of all contaminated supplies. Here again, they do not have to put those in a separate bag. We're not going to mark off if they do, but the CDC no longer requires it, and neither do we. When all candidates have stepped back, our proctor would say, all candidates have indicated they've completed this section of the examination. Please do nothing until the next verbal instructions are given. Okay, so we're going to go from here into microdermabrasion. So hold on just a second. Let me see if I can pull that up for you. And while Wayne's assisting me with that, I'm going to go over and get some questions. Okay, questions that were submitted earlier. After the blood exposure procedure, where is the appropriate time to remove the bandage? Upon cleanup of that procedure or the beginning of the next one in the aesthetics exam? So in the present exam, you are doing the microdermabrasion procedure on the forehead. So once the verbal instructions were read that you have 2 minutes to remove the supplies for the microdermabrasion process, then I would go ahead and remove that bandage from the forehead of the mannequin. Just dispose of it in the trash. You don't have to put it in a bag or anything, just simply throw it away. Okay, another question. If masks are required for the entire practical exam, can we assume they skip that part of the microdermabrasion procedure in the aesthetics exam? Certainly we haven't been over that yet, but we do require a mask even during non-COVID time. So they can certainly just eliminate that process. We realize they have a mask. We don't want them to take their mask off for any reason, including to put on a new mask. Is the bag with the steam towels inside viewed as a hot towel cabbie, and should it be kept during the exfoliation product procedure on the universal station as a result? The candidate can actually leave that bag on the table if they would like. It does represent a hot towel cabbie or a towel that has been steamed. It could be left in the bag. If their space is limited, they can sanitize their hands, go into their kit, remove that particular bag that has the steam towel in it, close that kit, and then sanitize their hands and go back to work. It's entirely up to them. Our new question is, in the aesthetics exam, do they have to use separate eye applicators between each eye? That's a great question. We're not looking for that. We are looking to see that they are bracing when they're working around with the eyeshadow, as well as the mascara. The mascara, certainly that should be a disposable item because of the possibility of moving it from one eye to another, but we did not include, honestly, that part in our examination, but it's certainly a good habit to get in, and I would encourage you to do so. Pardon me. Our next question is about the eyelash procedure, and I'm going to wait till I finish that, if you don't mind. I'm going to go over the microdermabrasion procedure in just a second, and then I'll go over with the extension of the eyelash band. Okay, and then another question for estheticians: if we cannot use single use items, makeup product, individual cups, can the candidate use a makeup palette to remove makeup from its original container? I would encourage a makeup palette. The individual cups many times become confusing. A lot of times candidates will reduce their product, let's say their foundation, and they will put it in a small solo type cup and mark it foundation. We don't have a problem with that, but they cannot work out of that original container. That container has to be considered as back bar, so they will need to remove that foundation and place it onto a palette. And as I said earlier, it could be a paper plate, a foam plate, a plastic plate, a metal plate, porcelain plate. It just needs to be removed from its original container. And then when they're finished and cleaning up for that, that product, meaning the foundation, would go into items to be disinfected because it is back bar size, no matter the size. Okay. Okay, and that's all I see for aesthetics. Okay, so we are going to go into the microdermabrasion, and so give me just a second to set that up, and then we'll go from there into the eyelash enhancement.
Hola, la pechocha. ¿Cómo amaneciste, mami?
Bien.
Bien, ay, qué bueno.
We had it to be the trap.
Okay, so our candidates are in place. They're told, and all of our additional service always have a 2-minute setup time. So they're told, you have 2 minutes to remove the supplies from your kit or the particle microdermabrasion on the forehead section of this examination. Do not begin any procedures until the verbal instructions are given and you are instructed to begin. Step back to indicate you have finished. When everybody stepped back, our proctor would say, all candidates have indicated they have completed this section of the examination. We will now proceed. Okay, so give me just a second. Our candidates are told, you will perform microdermabrasion. You will demonstrate vertical and horizontal strokes on the forehead. You will be expected to follow all client protection, safety, and infection control procedures. You will have 10 minutes to complete this section. You will be informed when you have 5 minutes remaining. Step back to indicate you have finished. The instructions certainly are always repeated. Our candidates are then told, you may begin. So we're looking to see that the microdermabrasion supplies are labeled in English. If an original manufacturer's label is present, it must have English and may be multi-language, but any created label must have English only. They're looking to see that those implements and supplies are visibly clean, and then we want that candidate to apply degreaser or prep solution. They will be wearing gloves after that or before the microdermabrasion, and certainly they don't have to have them to put the or to dehydrate the skin or to dry that. They are going to need to apply eye protection to the mannequin. It's very common when you're working and doing a particle microdermabrasion to get particles in the eyes. So we're going to take the caution of protecting the eyes of our mannequin or our client. That could be with a cotton round. That's what I see a lot of times. Sometimes they'll moisten a cotton round, they'll place that on the mannequin. And a lot of times I see them put suntan bed goggles over the top of that to help hold that in place. The candidate, of course, should wear eye protection as well. And certainly they already have a mask that covers both their mouth and nose because of COVID-19. That candidate here again will wear gloves. They're going to hold the skin taut, meaning without slack. And then they're going to demonstrate vertical strokes with a simulated handpiece across the entire forehead. the cord must be attached to the handpiece. So let's talk about that for just a second. A lot of times what I see, or a lot of times what I suggest, is going to the Dollar Tree, actually, and picking up a child's jump rope. Cut off one end or one handle of that and let it dangle. I would use the other handle as my handpiece, and certainly I would let the cord dangle. Sometimes I've seen people take a magic marker just because it's large enough to hold in the hand and work effectively. They'll attach a 4-foot string or cord to that and let that dangle as well. Now, we are looking to see that they do hold the skin taut while doing their vertical strokes. We're looking to see that that handpiece does fall to the ground. In other words, it can't be taped up. We don't want it going over the shoulder of that esthetician candidate. We don't want it wrapped around their arm. We consider all of those as infection control issues. We want it to dangle free. Very frankly, we want to see if they wrap it around the head of the mannequin, if they keep bumping that handpiece or that cord on the face, just like we were looking at and Wayne talked about when we were talking about the curling iron. Okay? Then they're going to demonstrate horizontal strokes with a simulated handpiece across the entire forehead, and here again, a cord must be attached to the handpiece. Afterwards, in doing the particle microdermabrasion, there are normally going to be particles that are left behind. We want that candidate simply to remove those particles from the treated area. That could be with a cotton round, it could be with a brush, like a fan brush or a mask brush, if that's what you taught your candidate to do. It could be with a 4x4 gauze. Just remove the simulated products that would have been left behind had you done a particle microdermabrasion. Certainly, we're looking to see that items to be disinfected, soiled linens, and trash should be disposed of throughout that section. We would also be expecting that candidate to apply moisturizer and or sunscreen. Afterwards, we know that some moisturizers have sunscreen. We know that some sunscreens are also a moisturizer. So we could do one and or both of those at the end. And then certainly we would be looking to see that items to be disinfected, soiled linens, and trash would be disposed of throughout that section. Okay. So let's go from there on to our eyelash enhancement. That is also a 10-minute procedure. Okay, candidates are told, like all additional services, you will have 2 minutes to remove the supplies from your kit for the eyelash enhancement section of this examination. Please do not begin any procedures until the verbal instructions have been read and you are instructed to begin. Step back to indicate you have finished. Instructions are repeated. The candidate is then told, you may begin. When everybody has stepped back to indicate that they've finished, our proctor would say, all candidates have indicated they have completed this section of the examination. We will now proceed with the next section of the examination. Our candidates are told, you will apply eyelash enhancement. You are expected to brace when working around the eyes. You will add a complete eyelash band to the full length of the lash line of both eyes. Okay, and what you don't see here is a statement that says you are expected to perform a patch test. That is included in the new verbals for the new exam. That is coming out in January 1 of 2021. And we will, at that time, expect your candidate to perform a patch test, and we'll talk about that in just a couple of minutes. You will have 10 minutes to complete this section. You will be informed when you have 5 minutes remaining. Step back to indicate you have finished. The instructions are repeated. The candidate is then told, you may begin. We're expecting the eyelash enhancement supplies to be labeled in English and that any implements and supplies are visibly clean, certainly meaning without dirt or debris. And then we want that candidate to perform the patch test. Now, a patch test, it should be, that area should be cleansed. It should be dried, and then they need to apply that adhesive to the back behind the ear. And so I certainly would do it that way. Here again, just simply use a cleanser, then dry that cleanser, and then apply that product, uh, that adhesive to the back of the ear, behind the ear. I would make sure that I did not touch the skin with the adhesive. I would put it on possibly a cotton swab, or I would put it on a toothpick and just apply a small amount behind the ear, even with a spatula. Dispose of that, and then just leave that at that point. Then we want them to brush the lashes in order to remove any foreign matter. And we know that there are no lashes on that. They just got going to mock that process here again, like they did in the makeup process, or simulate that, I should say. And then they're going to measure and cut their band to the appropriate length prior to applying it. A lot of times what I see that they bring a small piece of foil or plastic, they'll squeeze some of that adhesive onto that foil or to that plastic, and then they will apply with a toothpick or cotton swab, and usually it is a toothpick, honestly, or maybe a small wooden spatula, apply that adhesive to the band, and then they're going to apply the band beginning or starting at the inner corner of the eye, meaning near the nose, and they're going to apply that band so that the lashes follow the natural lash line. We do want to see them cut that separately, not apply it and then cut it, but cut it separately, then apply the adhesive to the band, and then apply that band starting at the corner of the eye, and they will be doing that on both eyes. Certainly, during that entire procedure, we are looking to see that items to be disinfected, soiled linens and trash, are disposed of throughout that entire section. So we did have a question on, let's see, how and when will the patch test be implemented on the eyelash procedure? Here again, that area should be cleansed with a cleanser. It should be dried, and that adhesive applied behind the ear prior to the application of the lashes. This exam, here again, becomes effective January 1, 2021. You will continue doing the present exam, the way both the facial as well as the eyelash enhancement, or any other changes disinfecting the way that you've been taught to do previously until January 1, and then all of the new things will go into effect at that point. Here again, if you have questions, I encourage you to send those to barbercosmo@dca.ca.gov, and if you would, write school overview in the subject. That will help identify your questions, and then certainly your state will be issuing those very, very soon. I am now going into the nail exam, so give me just a second to set up for that. Okay. Give me just a second here. It's giving me some changes. Okay, working hard over here now for you. Give me a second. Okay, there we go. Okay, in July 1 of this year, we came out with a new nail exam, and it's certainly different, just like our new aesthetics exam is different. It, however, will only go in effect, January 1 of 2021. Our subject matter experts have done a great job with this. There's a new area in here, and here again, it's going to be a little different than what you're accustomed to. But I would encourage you to continue doing exactly the way that you've been taught until January 1. And at that point, prior to going to that board or your students going to that board, make sure they have downloaded a new copy, get it from your state, and then they'll be ready to go with the new nail exam. Give me 1 second to take a swallow of water and I'll